With your hosts, Natasha Barrett and Melanie Hastings.
Hollywood is infamous for glamorizing plastic surgery at its best and at its worst. But anybody really needs to consider, if they're thinking about this, their options and their health before deciding to go under the knife. Dr. Joseph Michaels is the director of Monarch Aesthetic and Plastic Surgery Center, and he's here to talk about this fascination. Some people would call it an obsession with baby boomers and plastic surgery. Would you go that far at this point?
Well, I think everybody is really interested in looking as good on the outside as they feel on the inside. And I think that's really how baby boomers feel. They don't feel like they're considered senior citizens, and they really want to look on the outside and have that young spirit that they feel still on the inside.
The numbers, the stats that are showing not just women, Americans 65 and older going under the knife is rising. Is that because there's so many baby boomers that are living longer?
I think that has something to do with it. I mean, we're definitely heading into that baby boomer generation that are over 65. And a lot of these people are still working. They're still in the workforce. They're still leading active lifestyles. And as that population grows, and that's one of the largest growing subsets of age groups, we're going to continue seeing more and more of these patients presenting for plastic surgery.
Now, you've probably seen the story that made news last week. Nationwide, an 83-year-old woman out in California decided she wanted new breasts, so she went under the knife. What did you think about that when you saw the story?
I think it's something that makes you think about, you know, who's a good patient for plastic surgery. But really, age isn't the only criteria we use. And there's certain patients that are younger that aren't good surgical candidates for the same reason that an older person isn't. And so we need to really look at each case individually to decide who's a good surgical candidate and who isn't.
So in other words, if someone hears about this, it's not like, oh, well, I can do it too. You really need to think about, you know, and as any good doctor would probably guide you in the right directions and say, well, wait a second, what do you need to look at before agreeing to say, yeah, you have the money to do the surgery, I'll do it for you?
I think most importantly, we want to look at the patient's current medical conditions. Do they have any chronic conditions? Are they on any medications? These are really the most important things to look at when considering a patient. These are sort of the same things, again, that we would look at any patient.
I want to get your analysis. Would you perform surgery on an 83-year-old woman if she doesn't have any health problems? It still can be complicated, right, because of her age?
I think it really depends on the type of procedure. Some procedures require general anesthesia, which is a little more higher risk than something that can be performed under local anesthesia. So a certain procedure, the oldest patient that I've personally operated on is, for a cosmetic elective procedure, is 69 years old. And they did fine with their surgery. But I've operated on,
That's okay.
on reconstructive patients for trauma or other reasons that are much older and have done very well.
I mean, it can get risky. I mean, we're talking 83. Yeah, she doesn't have any problems that, you know, you look at her chart and you think, okay, you might be all right, but the older, the riskier, right?
Currently, there's no evidence that shows that these surgeries have an increased complication rate in the older patients as compared to the younger patients.
Okay.
But I do think you need to be very concerned and speak to that patient's medical doctors and really be extra stringent in your patient population. I think if a patient that was 83 wanted a long procedure under general anesthesia, I would be concerned and would potentially have some hesitation.
Yeah, her kids weren't too happy with her. She did admit to that they didn't want grandma to go under the knife because they were scared, you know, and they're not doctors. They're just worried in general. Well, I want to get to this other issue here. Not really an issue, just other stats, that it's not just women going under the knife. More men in America right now are doing it. Why are they doing that? Are you seeing some of your patients asking for things?
Some men are definitely predominating a little more than they were even 10 years ago, and it's doubled over those, I would say, the last 10 years. I mean, men, just like women, they're working longer. They want to look better in the workplace. They want to have that vibrant appearance, which I think everybody wants to have.
So they want to be competitive, just like the women. But I think the women admit it more than the guys would, right?
I definitely think so.
They try to keep it secret. So what are men wanting to improve in plastic surgery?
I think most men in general are concerned about their abdominal region, and liposuction still remains the most popular area that they're concerned about. And also their eyes as well, because they want to look younger and they don't want to have that tired appearance.
I would think that would just be for a man who probably doesn't want to admit to wanting plastic surgery or even getting it done. That's such an obvious change that you'd walk back into work and just be like, oh, no, I'm well rested. I had a vacation. But they're doing it.
Some men definitely are.
What else is on the list? You said the thighs, the eyes, even nose reshaping?
Nose reshaping or rhinoplasty is very popular. And a lot of gentlemen also want to have their chest reshaped. They may have some excess fat in that area, and when they're at the beach, they want to look, they want to compete with the younger guys, and they want to have their chest looking flat. And that's a very popular area now.
It's not just women anymore.
It's not just for women anymore.
Guys are doing it too. Doctor, thanks for coming in and talking to us.
Thanks so much for having me.
Up next on the show, still to come here, we're going to find out how one woman is running to make a difference. Plus, we made it through Irene, so how'd you do? We're going to take an inside look after the storm. And check out our blog. It's on our website, tvd.com, and it's under keywords, Let's Talk Live.
You're watching News Channel 8.